Wonderful. Well, thank you guys again for joining today. As mentioned, I'm Nimish Shukla. I'm the Chief Product Officer here at Vitable Health, and we're incredibly excited to be talking to all of you today about our new ICHRA quoting tool. So what we're going to do is I'm going to spend probably 10 to 15 minutes walking through some very brief materials, kind of setting the stage. And then I'm actually going to spend a majority of the time walking you through our tool that is live today, right? So everything that you see that I'm going to walk you through is actually available to you. Um, and you are able to go through and utilize the tool. And so we're going to provide you a little bit of guidance on how you do that, where are some of the areas that you might have a question, but also remember that we're always here to support you, right? So as you're going through, if you are working with groups that have a renewal coming up, as most groups do, right, with 1/1 approaching, and you're interested in offering them an ICHRA or showing them an ICHRA as an option, our team is always here to support you with running that quote, thinking through strategy. So I'll walk through exactly how you get in touch with us, especially as it relates to the quoting tool. Um, but we'll start walking through. So just very briefly, a little bit about me. As mentioned, I am the Chief Product Officer here at Vitable. Um, my career, I started and joined Vitable actually a little bit earlier this year as a part of an acquisition that Vitable Health did, and they acquired a company called LifeRaft, where I was one of the co-founders and started LifeRaft in 2020. Really focused on the supplemental space, working with ACA agents. But as a lot of that work, what we found was we had a lot of agents and brokers asking us for a better small group solution, right? A lot of the folks that we were talking to that were selling our supplemental plans didn't really necessarily have access to getting appointed for small group plans for fully insured. And so we're looking for alternative solutions. And so in actually kind of mid 2021, we launched our HRA platform at LifeRaft, right? So we were probably one of the earlier ICHRA administrators that were on the market, and out there working with agents and brokers to be able to provide not just ICHRA, but also all types of HRAs. Long story short, the company, as I mentioned, was acquired by Vitable Health, and so now we're a part of the team here, and really excited to continue our development and really along this path of how do we make ICHRA easier for our partners to be able to quote, to be able to onboard their employers, ultimately sell, and then really service, right? It's our view that our job and our kind of purpose within the ICHRA space is actually to enable you all to be able to offer these, understand them, but also then help your employers offer really good coverage at ideally rates that are going to be better than what they've seen, but also provide a real cost containment solution for them long term. It's my belief, it's our belief that ICHRA is really the right way to do that. And so, what you're going to see from our company and our team time and time again are tools and processes that make it possible for you to be able to offer these plans in a way that makes the most sense for you as a benefit advisor, as a broker, but also for your employer groups. So, as I mentioned, I'm gonna talk here through the slides just for about 10 to 15 minutes. We're gonna keep this really quick, and then we're gonna spend most of the time in the tool. But for those of the folks that might be on the call that are a little bit newer to ICHRA or maybe have heard it, right? Just a very, very quick overview of what it is, right? ICHRA, terrible acronym, long name, individual coverage, health reimbursement arrangement. But what it does is it enables an employer to offer a contribution for every employee to be able to go buy their own health insurance plan, right? Off the marketplace, off exchange, all of those options are available, but buy an individual plan, right? So what does this do for employers, right? Number one, real cost containment, right? If you think about the way that group health insurance works, um, you buy a fully insured plan. If you're in the medically underwritten market, right, you get to renewal. You're not really sure what you're going to see. Especially if you have some high utilizers on your plan, you're probably going to get a rate increase. You're fully kind of captive to that. And for employers, the end result is there is not a lot of predictability or visibility when they think about one of their biggest line items on their P&L, and that's benefits, right? The ICHRA allows an employer to set that budget, and although there likely will be increases year over year because it's going to be pegged to what happens in the individual market, the fundamental kind of driver of this plan is really thinking about benefits in a defined contribution way rather than defined benefit as we used to. It's really saying, look, here's the budget. Employees go pick their coverage, right? And then employees get to use that benefit. And so for employers, there's a real strength of cost containment. There are a lot of other areas where it helps for the employer, but from an employee's perspective, it also increases choice, right? They can actually go pick a plan that makes sense for them. That becomes really important, I think, for employees long term. So when thinking about, right, which groups are a good fit for ICHRA, I touched on the first one, right? Any groups that are looking to stabilize costs. You could have groups that have high utilizers that have actually just seen year over year renewal increases in certain states. Small group market rates have increased quite a bit, although they're community rated. Because of kind of increased morbidity factors, you're seeing small group rates are actually going up, right? And they're going up at rates that are pretty unsustainable for these groups to be able to then offer benefits. ICHRA becomes a really good cost containment solution, right? There's some other really interesting and strengths to the ICHRA here, right? Think about groups with low participation. One of the things we saw all the time at LifeRaft, and we still see at Vitable, is, hey, I need to offer something because I'm in the ALE world, but we have really bad participation because everybody gets health insurance elsewhere, right? That up until, there might have been options up until the beginning of 2024 for those groups. That's become increasingly difficult. And so if you're not able to hit minimum participation numbers that are required on fully insured group plans, ICHRA becomes a really good solution because you don't have any minimum participation, right? Businesses can build compliant benefits and have no participation and still be fully compliant. And not have to worry about getting kicked off a fully insured group plan. Um, a little bit to touch on that as well, compliance worries, right? We also see employers that maybe have never offered benefits. They're just getting into the ALE segment of the market. Like ICHRA becomes a really low hassle way to be able to stay compliant and offer benefits. The next one's a really good one, and it's for those companies where they might have remote workforces, right? A lot of you are probably familiar with this and have seen this, right? You have a group that's headquartered in California. They have 80% of their workers there. You have another 20% that are distributed across the country. What ends up happening when you're on a fully insured plan? Generally, there is one option that's going to be available, a national network PPO, which, let's be honest, national network PPO oftentimes isn't even a very good network. Your non-California employees in our example are now going to be, they're going to be forced to select that one plan if they don't have insurance elsewhere. ICHRA allows all of your employees to be able to select those plans that are local and are actually tailored to the geography that they live in. And so now we're not retrofitting and forcing everybody into one national network PPO that may not even have the providers that these employees care about. We're giving them access to their local market to be able to go find the plan that makes the most sense for them. Um, this goes hand in hand with cost, kind of cost containment and stabilizing costs, right? High utilization. Those groups that have seen year after year after year increases, double digits. This year, we're actually hearing from broker partners, we're seeing 35, 40. There are some pretty meaningful increases, and at some point that becomes unsustainable for businesses to be able to offer. And then lastly, groups, that have high employee turnover, right? Why is that important? If you think about this in the context of defined contribution, as we know, fully insured benefits, group health benefits are not portable, right? With ICHRA, the underlying health plan is portable, right? So if you have employees that or you see a lot of turnover at these employer groups, the individual plan can stay with the employee if they want to continue paying for it. And so it becomes a way to both offer a contribution when they're employed, but give them access to that healthcare, even if they're not, there's turnover. Now, thinking about just the mechanics of offering ICHRA, and again, I'm gonna run through these really quickly here. One, reimbursement based, right? There's a couple of ways that you can handle the actual payment mechanisms for paying premiums for an ICHRA. We have a couple of different ways you can do that with us at Vitable. The first is a real kind of reimbursement way. So employees link bank accounts, employers link bank accounts, employees pay for premiums, and then are actually reimbursed through a direct deposit that our system and our platform handles for employers, right? We make sure the premium was paid, the employee lets us know, we confirm that, and then at that point, money is actually moved from the employer to the employee. So that's one really popular way. That's where we started at LifeRaft about 4 years ago. But now we've also gotten to what you probably see from some of the other vendors that are in the space, right? Which is an automated kind of premium payment or list bill, very similar to list bill, where employers are paying 100% of all employee premiums. Our system is then giving them a payroll deduction file that is used to withhold the employee contributions either on a pre or a post-tax basis, depending on what plan was selected. But really, the key to both of these is trying to make the process for the employees of securing healthcare, paying for healthcare as easy as possible, but also for the employers, ensuring that we're not adding an additional layer of burden to them when they're transitioning to a new model of benefits with the ICHRA. Um, one of the things that we often get is like, how are you guys different than a lot of the other folks that are out there administering ICHRA? And to tell you just very briefly, Vitable was started 2020 in 2020, right about the time I was starting LifeRaft by Joe, who's our CEO. And the idea really was to provide better health benefits for your everyday worker. And the core of that and the core of our entire product offering today continues to be our Vitable primary care offering. It is a primarily virtual primary care service that can be included with an ICHRA, that includes unlimited primary care visits. It includes mental health. There's about 1,000 scripts that are included on our and actual pharmacy benefits that's in there, as well as labs, all $0 copay, $0 out-of-pocket cost to the employees. Um, and so I mentioned a little bit about this, but in addition to kind of the core primary care service offering that we have, we do have other services that are available. One that's been really popular is a GLP-1 program, one that provides both clinical support at the time of prescription, and helping employees assess and identify whether or not they require GLP-1s, but then also a continuity of care through their journey of utilizing GLP-1s. With it, we also provide very, very attractive cash pay rates to be able to access non-compounded branded GLP-1s for these employees. But most importantly, this is not, us offering easy access to prescriptions. It's really backed by a very strong supported clinical pathway to ensure that employee outcomes and health outcomes are actually improving as well. Um, so again, there's a lot that's built into our primary care products that assist with those um, everyday access items that a lot of the employees are going to need, and really does lead to kind of better health outcomes. I'll just briefly say as well, all of it is it's mobile. It can also be on desktop, right? That's a question that we get often. So we make it really easy for members to utilize this right on their phone, open up the app, texting, calling, scheduling video visits. But really, what we've seen is very, very high utilization, which is exactly what we want of primary care, with really high satisfaction scores. Um, I'm going to jump through a little bit, but I know we're going to talk about the quoting tool, but in the event people are thinking about this, when you think about ICHRA administration, like why I think this is important, right? ICHRA, very, very powerful tool, allows employees access to plans that give them choice, I think make more sense for them geographically. They can pick the doctors that make sense to them. Um, primary care offers an incredibly affordable and an incredibly value layer of value and care for these employees that can sit alongside whatever individual market plan they choose, right? For those employees, especially that might, for cost reasons or health reasons, right, select those plans that have higher deductibles, higher out-of-pocket maxes, particularly with some of the changes that we're going to start to see. Um, you know, primary care becomes a way for them to access care and not be subject to hitting those deductibles and out-of-pocket limits or paying towards them if they have a cold, right? Or they really need to see a provider. And so it provides a centralized, but also a very high leverage, low cost way for people to access healthcare. Um, you know, our view, as I mentioned at the beginning of this, right, is how do we empower you all, our broker partners, our benefit advisor, our platform partners to be able to offer ICHRA, quote ICHRA, and ultimately enroll ICHRA, right? And so we built everything that we build is with these partners in mind, right? Whether it's how we price our services, whether it's your ability to be able to also monetize, whether it's do you want agent of record or do you not want agent of record, right? Um, Whether it's our quoting tool, which is a great example, customer service, like that is our entire focus. And so we've built everything that we have built here at Vitable with our broker partners in mind. Um, Another question that I know is going to come up, so I just want to go ahead and address here. There's a couple of different ways that we price ICHRA administration, and it really comes around down to whether or not you'd like to have virtual primary care included. And so, if you have groups that are fit for ICHRA, you want us to administer them, and they do not want virtual primary care. The cost for that is $17.50 per employee, enrolled employee per month, right? There's a 1750 PEPM. If you include virtual primary care, so Vitable's virtual primary care, it's going to be 30 PEPM, right? And so we've priced our services really attractively. And again, 30, which I know the ICHRA market pretty well. It's very, very competitive. You also are giving those employees access to that care, those $0 copay deductible visits. Um, want to add very quickly. Um, we allow our broker partners uh, to set their administration fees on top of ours, right? So said differently, let's say you onboard a group for ICHRA and VPC, our administration rate will be 30. You are free to add whatever you think is the right PEPM. And then again, going back to AOR, we give uh, all of our broker partners the ability and choice to be agent of record on some or all of their individual enrollments. Great. That's what I had from just wanted to provide a brief overview. Now I want to switch over for majority of our conversation into the thing I'm incredibly excited to show everybody about that we've been working really hard on, which is our quoting tool. As I start to switch, please feel free to drop in any other questions on Q&A, um, and we'll get those answered as I just pull this up here.
And I accidentally clicked ask answer live for DP. What does DPC stand for? So I'll just answer right now. It stands for direct primary care. It's Vitable's primary care service that we offer.
Great. All right, folks. So let's go ahead and talk about the quoting tool. Couple of things I want to mention here, right? ICHRA quoting, over the last several years, I think has made a lot of advancements. What we believe and what we have seen at Vitable is, again, for you all that are out there talking to employers, you're working directly with them, you're seeing renewals come in. We know that you have a workflow that you need to complete, right? You're pulling quotes from maybe a couple of different places. You want to show your employers ICHRA as an option. And in the past, and even today, I think to some degree, getting an ICHRA quote, in our opinion, and in my opinion, was always way too hard, right? You'd send a census off, and then you'd wait a week or 2 weeks. It's just like the group market, right? And so as we thought about like, hey, how do we make this process easier and better for our broker partners? It really came down to building a real-time quoting tool that puts the control back into your hands, right? Um, um, uh, it puts it back into your hands. And so we're gonna walk through how it works, what it looks like. Um, but if you are interested in using it, if you don't have it, here's the website right here, partners.vitablehealth.com. And maybe Natasha, you can put it in the chat as well for folks. In the event that they can access it there. But that's where you're going to go. You're going to go to partners.vitablehealth.com. There's some basic information, but let's go ahead and actually look at the quoting and scenario playing tool. So I'm going to go ahead and get a quote now. That's going to bring you to this input page, right? So think about this is when you're starting off. You've got, hey, I just got a census from this group. I see their renewal. I know what their cost is going to be. Let's go ahead and get a quote. What you're going to do is drop in some basic information here about you as our broker partner, your email, why you can see right here, but we have folks give us their email, one so that uh, we can get you the quote and the proposal, which you can download, but we can also email off. But also you'll see you have an ability to kind of save a couple of different scenarios. This is where you're going to drop in company information, right? So this is going to be for the company that you're actually quoting. Let's say it's Bob's Tires, right? And then here you can actually put which quote year you want to run for, right? As we're getting into 2026, you'll see there's current year and there's also next year, 2026. One thing I do want to mention with the quoting tool right now, the rates that are available are current year 2025 rates. Why don't we have 2026 rates? Very good question. I wish we had 2026 rates, but obviously everything with the state regulators and everything that's been happening in Washington this year has been a lot slower. We have seen in terms of getting the data for final 2026 rates. And so once we have those, we will let everybody know so that you can go ahead and run those 2026 quotes. But for now, it is 2025. Um, and then you're going to give us a census, right? You can click, you can drag it from your desktop. Couple of things to keep in mind, right? The census is a big piece of this. It's what allows us to run that quote for you. There is a census template format. So you can either download that and use it, or if you run into issues with it, what will happen here is if you include a census and it doesn't fit it, or there are any issues that come up, it's going to flag it for you and let you know, hey, there's a couple of errors we're going to need you to fix for it to be able to run you the quote. But here's a good example census, right? Um, uh, Name, date of birth, zip code, income. Do they participate today? Yes or no? And then also, like, if you have dependents in there, right? What is the relationship? So self or spouse or child. Um, Couple of things I'll mention, right? Again, one, you upload a census, the fields aren't exactly correct. It's going to let you know, hey, can you fix these fields? Number two, if it's becoming, unruly or you're unsure of what to do, Natasha, can you drop the email in there as well into chat for everybody? But what you're going to do is you're going to email, I believe it's brokers@vitablehealth.com. What we will do, send us your census, let us know you need an ICHRA quote. Our team will format your census, upload it, and then send you a link with your pre-populated quote that's ready to go for you. So I know this is a busy time of year, and so for any of our folks here that are finding it difficult to kind of transform the census data, just send us an email. We'll do it for you. We'll run that quote for you. We'll send it back to you, and help you out. Um, once you've gotten the census in there, what you're going to do is you have the ability to customize some quotes here, right? So you can set as a default, hey, I just want to use whatever the minimum affordable scenario is, and that's going to use the cheapest silver in everybody's geography, and set a reimbursement or a contribution amount that's going to ensure that your group or the contribution structure that you build is ACA compliant, and meets affordability. You can toggle whether or not you want to offer virtual primary care, or Vitable primary care, um, to your customer. This is where you can also then add where you want to set your PEPM, right? So let's say you want to set your PEPM at 15. You can do that here. Um, um, if you have spoken to our team and there is some pre-negotiated fee discount, this is where you can drop that in. But again, I want to be very clear that has to be communicated and agreed to by our team before we have any fee discounts that are built in. And then also for a cost comparison perspective, because we know that can be incredibly important, this is where you can just go ahead and drop in your the current cost that your employer group might have for their fully insured group plan. Um, this is the input page. Any questions on inputting or how to start the process of getting a quote? Great. So what I've done, because we're doing a live demo, to make sure we don't run any issues, I've gone ahead and uploaded a census. This is an example scenario, but uploaded that census, completed that information. If you do that, this is what you're going to see, right? You're going to get this real time, uh, one quote, but also number two, the ability to really manipulate and play with that quote depending on what makes the most sense for your employer group, right? So let's go ahead and talk a little bit about what you're seeing here and what are some of the levers that you can pull and play with in terms of the functionality here. So you'll see here when I uploaded my census on that scenario, I went ahead and hit affordable. Just run me the affordable scenario, right? The minimum required to ensure that we're meeting ACA affordability. And this is what's coming out, right? So for this group specifically, based on those cheapest silver plans, this is how much the employer is going to contribute. This is how much the employees would contribute, right? Based on the cheapest silver plan, assuming everybody picks that, and the total cost of that. Um, the employer contribution, the administration fee for Vitable, right? So here you'll see, I do not have a broker PEPM in there, but let's go ahead and just toggle that on, right? So you'll see here, this popped right up. You now see there's a broker fee built in here of 33 PEPM. Change the cost. If you decide, hey, you know what? I think for this group, they're not going to want Vitable primary care. Let's go ahead. You'll see down here, I can just turn that right off. And that actually drops the Vitable administration fee down to 1750. And so these are all inputs and things that you can play with as you're looking at your as at your quote. The next big area I want to show everybody, right, is because we're looking at building compliant ICHRA contribution, the way that our system does that is on an age-banded basis, right? As you know, for those of you that are familiar and have run ICHRA quotes before, in addition to ACA affordability, one of the big things we want to make sure we take a look at is ERISA compliance, right? And so um, because individual health insurance gets more expensive for our older employee base, we do want to contribute more to them, and we have to, right, to maintain affordability, but we can never exceed our kind of 3-to-1 ratio from oldest to youngest of employees. And so we show you by age band, right? How many employees are in that 0 to 29 age band? What is the reimbursement? And what would the total employer contribution be? If you have dependents that are built into your census, we will also show you if you want it, right? So right now, I have considered dependents on. You can build kind of the what I call the stream down ACA compliant ICHRA quote, which is no dependent coverage, employee only, minimum to meet affordability. If you do want to include dependent If you do want to include dependent coverage, um, that can be toggled on and off, right? The last thing, and then I'll talk more about how to kind of play with the quote and what you can do with it. We list out employee by employee based on the scenario that you're running. What is the plan, right, that is assigned to each of these people? So you'll see here we're still on the affordable scenario. So we're looking at the cheapest silver. So for Aaron Campbell, right? The cheapest silver plan for him is an AM Better Silver HMO. Monthly premium for that plan is 688.90. You'll see down here, given his age, he's getting 912.18, which means for him, the cheapest silver plan actually is no employee contribution. And again, that is available employee by employee, right? So when you're going into these meetings with employers, I think one of the biggest questions that people often ask, the employers do, um, is well, what sort of plans are available to my employees, right? I want to make sure that my employees are seeing good plan options. This tool allows you to show that to them in real time. If I was a broker, right, I would probably be doing two things. Number one, sending my employer group the PDF that I'm going to show you in a few minutes, sending that to them in advance so that they've had the ability to kind of pre-read that. But I would have this ready to go on your laptop so that as you're talking through the ICHRA, you can real-time model and scenario plan this with your employer group if they're asking you questions like, well, if we decided we wanted to actually cover towards gold, what does that look like? How much is that going to cost us? What's that going to cost our employees? What plans are going to be available to our employees, right? Like these are all questions that you absolutely will get. And we built this tool so that you can bring it in there with you and actually answer those in real time and have that meaningful discussion and really advise your clients and your employer groups on how is this going to work for you? How is this going to work for your employees? And ultimately, what is the cost impact to you as the employer? So here are kind of the key areas of output on the planning tool. Let's go ahead and look over here on what are some of the things, what are the different things that I can do here. So as I mentioned, right, I ran an affordable scenario. The tool will base that off of the affordability metric, everybody's income, but then also the cheapest silver plan. Let's say I want to turn that off and I actually want to say, you know what? Um, my employer actually just wants to look at contributing 35% of everybody's premium, right? Couple of things, right? Number one, our tool will always tell you if you're dealing with an ALE especially, right? If you are looking at scenarios where the contribution amounts, right, that are a result of that, so 35%, for example, in this case, do not meet affordability, our tool will tell you that, hey, this does not meet ACA affordability. So as you're running those scenarios, keep that in mind. But we really try to make this as easy as possible for you. And you can slide this up and down, up and down. Based on my example census and how the where I set the incomes, you're going to see that that number is a lot higher than it probably would be for regular census. But at 100, it's now compliant, but you have the ability to kind of play with that. So I'm going to go ahead and hit affordability back on. The next thing I want to mention here, right? If you're working with a group that has multi-state employees, um, there's a couple of things to keep in mind here, right? For those of you that are familiar with the individual market, um, the cost of individual health plans really varies state by state, right? A plan in New York, the cheapest silver plan in New York for a 35-year-old does not cost the same as the cheapest silver plan in Idaho for a 35-year-old. Um, why do I bring that up, right? When you're thinking about developing an ICHRA contribution strategy and a quote for a group like that, there's two ways that you can do that. Number one, you can set one contribution strategy for every employee at the company. That's what we're looking at here, right? Every 30 to 39-year-old is going to get 9, 12, 18. Every 40 to 49-year-old, depending on their age, is going to get somewhere between 9, 12 and 1,002. Um, and the reason we have that range, by the way, I should mention, is because I have dependents toggled on. What you're going to see is um, because we're including dependent coverage that there's a range there, but you can always expand the table to see for employee only or employee and spouse or employee and family. Let's just run it on employee only. So you'll see here, right? Going back to, why, what's the point of classing by state? So this is assuming, hey, everybody gets the same contribution. Um, that's one option. The other option is, hey, I know I have a multi-state case. Let me go ahead and see what it would look like if I class this out by state. And what we mean by classing out by state, for those of you that may not be familiar, is setting a contribution strategy that is state specific. So you're still going to see age bands, but what you're going to see is people in Idaho are going to get a different contribution amount than people in New York. And the reason is, again, there's variance in the cost of a plan, even at the same age, depending on the state. So I'm going to go ahead and toggle that on. So what you're seeing now, right, is I want to, sorry, I'll toggle it back up. You'll see down here monthly total reimbursements, right? Just about $77,000 in this example. When I class it out by state, my number comes down to 64. Why? Because again, we have people in different states. And so you're going to see here that it's on an age band, but if I open this up, what you're going to see is state by state, what is the contribution amount? And you'll see here for those 40 to 49-year-olds, we get Connecticut thrown in here, which is a more expensive state generally. And so you're seeing that the person in Connecticut, right? We have one employee in Connecticut, they're going to get 437.97, but our 40 to 49-year-olds in Florida and Pennsylvania will get 414. And so you have the ability to play with that and turn that on or off. The last thing I want to mention in these little toggles here is participating employees only. So if you remember in the census, what there is a field that is participating, and that is that employee participating in the health insurance solution that the group is currently offering today? Um, you can run your ICHRA quote, and we allow you to run your numbers um, off of the entire census, right? For a compliance perspective, we need to make sure that we run your numbers and contribution strategy on the entire census. But if you want the employer and you want to give them a really good sense of, hey, if everybody that's on your plan today continues to participate in the ICHRA, what is the cost going to be? Just toggle this button on. And what you're seeing here, right, is my number of participating employees went way down. I had 26 in 0 to 29, but we know that only 10 of them are actually participating in today's plan. So if those same 10 people participated in the ICHRA, here's what your cost is going to be. And again, you'll see we were at about 77. That's now down to 43, right? And why? Because we're only looking at those employees that are participating in health insurance today. Great. Um, all right, so let's go to some of the other fun things that you can do here. So what I'm going to do now is I'm actually going to turn off affordability. I'm just going to go ahead and set contribution at, let's say, 50. The next thing that we allow you to do is filter by metal tier. So you can anchor your employer's ICHRA quote to whatever tier you want to. Now, remember, our tool will always let you know if you're working, especially with ALEs, to keep compliance and affordability in mind. We're going to let you know if a scenario you're running is not affordable right up there at the top or not compliant. But you can run these on gold, right? So if you'll see here now, this is going to show you the cheapest kind of gold plan for everybody in their area. You can also run it off of a platinum plan. If you're running a quote and you run it on platinum, and for an employee, a platinum plan is not available, just to let you know, it's going to kick them down to a gold. So if a plan configuration is not available for an employee based on their zip code and their geography, we're going to show them the next best option and build your scenario around that. But again, you can really play with this as much as you want. Where do I see this happen? When we've worked with employers in the past, but also with our broker partners. Again, when you're in that meeting, this is one of the things that we see a lot of employers ask about is, okay, that's interesting for silver. Like, hey, if I wanted to make this a little richer, can you show me what it would look like with gold? And so you have the ability to kind of to play with that for folks. Um, the other thing you can do is depending on the zip codes of the employees, we're going to show you all of the different carriers that are available. And so you can actually then filter and build your contribution strategy based off of um, any of the carriers that are on here. So let's say, and this is a multi-select, by the way. So let's say we want Personality and better. We want to see some Oscar plans. What that's going to do again is when you add a filter like that, if it's just one company, um, for everybody that has an available Oscar plan, that is the plan that's going to be quoted. For those that may not have an Oscar plan available to them, we're going to move to whatever in that plan tier. So, like gold, for example, I think I'm still on gold. We're going to show them then the cheapest gold that's available. But let's go ahead and add, let's say, Capital Blue Cross as well, Connecticut Care, Fidelis Care. So I've added a bunch of carriers. You'll see here now that the number of carriers and the names that we're seeing are actually show up here. So again, complete configurability for you guys. One of the things that we've usually seen and why we built this in here is you have a group that's transitioning, let's say from a Anthem plan. Um, a lot of times what they might want to see is, hey, okay, let's see the affordable scenario. I'd love to look at that. But then I also want to see a scenario where uh, everybody's on a individual Anthem plan or a BCBS plan, right? Our tool gives the ability to do that for them. And so you can again, you can do that in real time when you're with them. The other thing you can do is you'll see up here we have a select scenario. Um, um, what you can do is actually add scenarios and name them, right? So you'll see here there's a little button. Hopefully, folks can see this that allows you to name your scenario. So let's say in advance of meeting with my employer, I want to run an affordability base affordability. I'm going to hit save on that, and I'm going to just keep affordable, class by state, consider dependents, right? So that's one of my scenarios. I'm going to add a new scenario. I'm going to rename this selected carriers. All right. So now I'm on my selected carrier scenario, and here I'm going to turn off affordability, and I'm going to say, you know what? We've got people in Florida. They really want Florida Blue. Um, Some people wanted United, we wanted Oscar, and we wanted to see Aetna CVS. Um, so you'll see here, right? Oscar plans and better plans, like all of those carriers that we'd selected, those will show up. Now I have two pre-saved scenarios. So if I go back here, I can go to my base affordability and say, okay, base affordability, everybody's on the cheapest silver. Here's what it's going to cost. But you wanted to talk about selected carriers. Let me go ahead and pull that one up. And I'm back to my selected carriers. And I don't think I saved that correctly, but that will work. Great. Last couple of things, and then we'll save some time for questions. Um, Next question might be, great. What do I do with this now? So we give you a couple of options here. So um, you can either, for each scenario, you can either share a link. So you hit share, you'll get a link. You can actually send this to your employer group. You can send this to your colleagues in the office. Um, and that quote link will actually bring them right to this scenario that you've pre-populated for them and you've prepared for them. So that's one option. The other option is if you hit this generate PDF, I'm just going to go ahead and let that generate. It takes a couple minutes here, but I'm going to show you what comes out of it. Um, so we're going to give that a minute. The other thing, there's a little button over here that I'll show you once the PDF is done generating. Um, that's how you can get in touch with our sales team in the event you need our assistance with uh, the scenario, any other plans. So you see here my PDF just popped up, and here it is. So prepared for sales. So because you're putting your email in, uh, your email will show up here, the date, some basic information and ICHRA overview, right? So as you're doing kind of the employer education, what is it? How does it work? Um, the summary, right, of the monthly cost from that quote that you ran. So if you have given us your health plan, like what their cost of what the employer is currently paying for health insurance, the headline number, right? And this is what we've seen a lot of is here's how much money you're going to save in this year if you're transitioning to ICHRA. Um, a breakdown of employee versus employer contributions, what the total cost would be, and then also the administration fees, right? So giving them a really clear understanding of what that total cost, all-in cost is going to be. Also, just a couple of things that you can talk to, right? Hey, this is the compliant scenario, right? We're going to make sure it's affordable, or we know the contributions are affordable. For this, they've been benchmarked, right? The contributions are built off of the lowest cost silver plan. Dependents are not built in. You're going to be able to walk them through, hey, here are the different contribution structures based on age ranges, and then some additional information available on classing, compliance, what next steps would be, how to think about contributions and moving money, a little bit about Fightable. But what I want to get to here, great. I want to walk you to the end. So if you remember at the bottom of the scenario planning tool or the quoting tool, um, there was a employee by employee set of every plan available, the cost, the employer contribution, the employee contribution. We put that into this PDF for you as an appendix. So for those employers that want to get into the employee by employee plan details, that's available for you in this PDF that's automatically generated. Um, Great. Two things. The last couple of things here. So, if you can actually contact our sales team in the event you have any questions that come up as you're using the tool. If you just click that button, it'll open up your email. The other thing you can do is when you upload that census, if you'd like to download that census and just have it on hand, you can actually click that button and download it here. Natasha, anything that I've missed or that you would highlight that I might have forgotten to highlight for folks?
No, I think just if folks have specific questions to put them in the Q&A and we can answer them live in the last couple minutes of this chat. And I appreciate everyone staying on a little bit longer. And we did share in the Q&A the link to use this tool. It's partners.vitablehealth.com. And then you can, if you need help formatting your census, you can email brokerage at vitablehealth.com. And yeah, we'll be sending out the recording after we get off so you can review it as well. Thank you,
Eleanor.
Robbie.
Yep. Eleanor asked, do you also help with administration, banking, and so forth after the quote is approved? Great question, Eleanor. Absolutely is the answer. So from here, if you run the quote, you have a group that's interested in signing up. We handle all of that. We have banking solution built in. Um, there is an on-platform shopping experience. Uh, yes, Eleanor, if you want to keep agent of record on those individual health insurance policies, we also allow you to do that. Um, and so we provide everything for you to be able to both do that, but also then offer the ICHRA and administer it. Great. Um, doesn't look like we have any other questions that are coming in. I'm happy to stick around for a couple more minutes. Appreciate everybody. Again, thank you so much for joining. Um, As a reminder, partners.vitablehealth.com if you want to try out the tool and run an ICHRA quote. And we look forward to working with you guys. And thank you again for joining today.